So not all class 2s are created equal. So when I realized this, it created a bigger question for me, and I've kind of hinted toward this. With such a variable or variance in what we do with class 2s, how can we expect a single system to handle every single case in an effective and efficient way? And the reality is it's kind of hard to do that, right? So we need multiple tools to be able to solve different situations depending on what we run into. And that's where I came up with this idea, and I call it BurtonBands posterior. And the BurtonBands posterior, you can see here, and we're going to see it from a few different angles, but it's essentially it's a wedge matrix unit in one. And if you look at this from a couple different angles, there's two key components to it: the wedge, of course, and the matrix. And the wedge has a unique design that splits. So the wedge wings here are not bound at the tip. So these wings can float independently when you place them in the embrasure. And this does a key thing. It allows the side that's attached to the matrix band, which you can see here, this side right here, it allows that wing to float with the tooth around line angles and helps create good contour and good matrix seal all the way around the curving angles of the teeth, because our teeth aren't flat, right? So they're always curving, they're always changing directions. And the other thing is a very designed or contoured matrix band. So when I designed this, I wanted to put a marginal ridge in this, and so it would have it built in and ready to go. And so we would have to do as minimal amount of polishing at the end as possible. And so this is what the design of the system is: splitting wedge, matrix band, and it is a very effective device in certain situations. And this is just a couple different angles. We will drive into this. So where is it effective for? And I say it's a unique tool for unique situations. So what I was talking about earlier, not all class 2s are created equal, right? So for a majority of what I do, I'm using standard matrix and ring systems, and that's the most efficient thing for me. But when I run into these situations, and I'm going to go through a few different ones here as we go, then this is when I start to use it. And one of the cases is the unexpected class 2. For example, you get in, you're doing a class 1, you're set up for a class 1, you have however many minutes, 30, 45 minutes to do it, no problem. And then you kind of start to clean out the mesial portion of that class 1, and you realize that it is indeed a class 2. And so it's one of those great things that you can just pop it in there, because a lot of times those aren't that large of lesions, because you didn't see them on the radiograph, they didn't show up, but they were there clinically. And so it's a great little thing to pop in there and just be able to bail you out. Another area, mesial lesions on second molars or the poor access and short clinical crowns. So, these areas of poor access, and which is the second molars, they have a lot of variables that they throw at us, right? It's tough to get to. The crowns are short, so a lot of times our ring systems have trouble engaging them, and it's hard to see, and we want the fewest things possible back there to not impede our working environment. In another section, interproximal root caries below an existing restoration, and we'll go over all these. Tight embrasure scenario that I was talking about, MOD situations, mid-ortho class 2, this is an interesting one, and mesial lesions on first bicuspids. And so let's dive in